Other than stroke volume, the other end of the equation, which can affect cardiac output, is the heart rate. And this last part of the chapter deals with regulation of heart rate. So any factors that increase heart rate are called positive chronotropic factors. Any factors that decrease heart rate are referred to as negative chronotropic factors. So here are the items that can affect the heart rate. The ANS, chemicals, and other factors, so let's look at each one individually. So let's look at the autonomic nervous system. First, the sympathetic division. Right? We know that the sympathetic division will stimulate the heart and it'll cause the pacemakers to fire more rapidly. That will increase your heart rate. The end diastolic volume decreases because the fill time has decreased. With a faster heart rate, it doesn't have as much time to fill up. This increases contractility, though, so end systolic volume also decrease because the increased volume of ejected blood. So these two things really are a wash because both EVD and ESV decrease, the stroke volume remains unchanged. But the heart rate is still increasing, which is going to affect or increase the cardiac output. With the parasympathetic division, it opposes sympathetic, so it's going to slow your heart rate down. It doesn't have any effect on contractility. It doesn't innervate the ventricles. When sympathetic is activated, PNS is inhibited. Parasympathetic nervous system is inhibited, and vice versa. So, under normal conditions, when the heart is at rest, it exhibits what we call vagal tone, consisting of the vagus nerve, which is the parasympathetic supply to the heart. So parasympathetic is dominant when under normal conditions when we're dealing with our heart rate. It can decrease your rate by about 25 beats per minute if it has to. Without vagus nerve innervation, our heart rate normally would be 100 beats per minute. So that brings us to this side of the chart now. We can increase our cardiac output by increasing our heart rate. How do we do that? By increasing sympathetic or by decreasing parasympathetic activity. Because changes in the ANS will affect central nervous system output, but it's going to increase or decrease your heart rate depending on whether we're dealing with sympathetic or parasympathetic. And these arrows tell us which way each have to go, but you probably should be able to guess this based on A and P1, where sympathetic increases, parasympathetic decreases, but decreasing parasympathetic will increase heart rate because decreasing one increases the other. Your heart rate can be affected by chemical regulation, notably hormones. We know that epinephrine is a hormone secreted by the adrenal medulla from chapter 16, and its effects will be like the sympathetic nervous system, which will increase heart rate. Thyroxine, the thyroid hormone, will also increase heart rate, and it enhances the effect of your sympathetic hormones. Of course, our ions, like calcium, will increase heart rate when they're in higher concentration. These ions must be kept at very specific concentrations, if not they can be very dangerous. So here are some imbalances or homeostatic imbalances. Right? Hypocalcemia, low calcium in the blood, depresses the heart. Hypercalcemia increases the heart rate. Hyperkalemia, which is excessive potassium in the blood, can lead to a heart block or cardiac arrest, or hypokalemia, deficient potassium in the blood, results in feeble heartbeat, which is a weak heartbeat, or arrhythmias. And then other factors that influence heart rate: age, heart rate declines with age; gender, females generally have faster heart rates; exercise increases heart rate; Trained athletes have a slow heart rate at rest. Body temperature, heart rate increases with increased body temperature. And we can end this chapter with some clinical terms here and congestive heart failure. So let's look at these. Tachy means rapid. Tachycardia is a rapid heartbeat, over 100 beats per minute, but not while you're exercising, an abnormally fast heart rate. Elevated body temperature can do that. Stress, some drugs, heart disease. This could lead to fibrillation, which is, of course, extremely dangerous. Opposite of tachy is the prefix brady, which means slow. So bradycardia is a heart rate slower than 60 beats per minute. You can see a lot of this here is the opposite if we just looked at above. Low body temperature, certain drugs, parasympathetic nervous system activation. This is a desired result of endurance training. Endurance athletes have very slow heart rates. If it's not because of training, there could be inadequate blood circulation if your heart rate is too low, of course. So congestive heart failure, or CHF, is by definition your blood cannot meet the needs of your tissues. So the cardiac output is so low that your tissues are not being supplied by the necessary levels of oxygen or nutrients. Different ways this can happen. Let's take coronary atherosclerosis. So recall your coronary arteries, which supply oxygen and nutrients to your heart muscle. If atherosclerosis is occurring there, these are clogged heart arteries. That means oxygen cannot be delivered to your heart cells, and your tissue in your heart becomes devoid of oxygen or low of oxygen. Hypoxic would be the term there. And your heart will not be able to contract efficiently if the muscle is not properly maintained with oxygen and nutrients. Persistent high blood pressure. So the pressure in your aorta is high, and your heart muscle must contract more forcibly in order to pump blood out to the tissues. Over time, the heart muscle will enlarge to meet the demands, but that will eventually cause it to weaken as these high demands are placed on it. Multiple heart attacks, myocardial infarctions, the heart will become weak because certain cells are replaced with scar tissue, so the heart will not be able to pump blood to the tissues effectively because there's not enough muscle to do so. In dilated cardiomyopathy, pathy just means disease, so this literally means disease of the heart muscle. Ventricles stretch and become flabby, so you don't get that recoil or pliability of the heart muscle anymore, and the myocardium will deteriorate, which will not allow effective blood being pumped to the tissues. So either side of the heart can be affected. So let's take the left side first. That will result in pulmonary congestion. Here's why. If the left side of the blood or of the heart is failing, well, where is the blood coming from that enters the left side of the heart? If we backtrack, we see, well, it's coming from this pulmonary circuit. So the left side is failing, then fluid is going to build up in the lungs because it can't get pumped out of the left side of the heart efficiently. So this backup of fluid into the lungs would be called pulmonary congestion. So left-sided failure results in pulmonary congestion because blood backs up into the blood vessels of the lungs. And fluid will leak into the lung tissue, causing a pulmonary edema. Now let's look at right-sided failure. Let's look at right-sided failure. If the right side fails, meaning the right side of the heart can't pump blood out effectively, well then fluid will start to build up. And where is it going to build up? Well, in the tissues. So we call that peripheral congestion. So blood's going to pool in your body's organs, causing edema. That's a fluid buildup, especially in the extremities, like feet, ankles, and fingers. But even though we went through each side individually as far as congestive heart failure goes, if one side fails, the other side will ultimately fail, because you can just keep following the circuit and keep backing it up until you get to the other side. So it's inevitable that one side heart failure will eventually lead to the other side failing. That's not repairable. Removal of fluids will help, but that will end kind of our discussion here on congestive heart failure.